Senator from Pennsylvania.
Mr. President, I rise this evening to speak about the Republican effort in the Senate by way of a budget resolution which includes so-called reconciliation instructions to repeal the Patient Protection and Affordable Care Act. In this case, unfortunately, without any replacement for that legislation that we passed a number of years ago. In a word, I think this is a plan for chaos. Chaos certainly for insurance markets, but more particularly, chaos and damage done to middle-class families whose costs will go up. Of course, their coverage will be affected adversely. A repeal effort without replacement would raise the price of prescription drugs for older Americans across our country, put insurance companies back in charge of health care, and in fact cost our economy millions of jobs and devastate funding for rural hospitals and rural communities in Pennsylvania and across the country. I think on a night like tonight, when we're just beginning a long debate about how to bring affordable care to Americans and how to continue that, we should reflect back on where things were before the Patient Protection and Affordable Care Act. Over 50 million Americans were uninsured in 2009. 50 million people. People with any sort of medical condition were routinely denied health insurance or were charged exorbitant rates because of their health histories. Women in the United States of America were routinely charged more than men for their health insurance. And finally, and this is not an exhaustive list, finally, individuals who were ill were routinely dropped from their health care coverage because they had reached arbitrary caps on the amount of care an insurer would pay for a given year. So let's talk about what's happened since then. Since the passage of the Affordable Care Act in 2010, we've come a long way. 20 million Americans, more than 20 million Americans, including almost 1 million in Pennsylvania, have received health insurance as a result of this one piece of legislation. 105 million Americans are protected from discrimination due to pre-existing conditions. That's 105 million Americans with pre-existing conditions who are no longer barred from treatment or coverage as they were before. 9 million Americans have received tax credits to help them cover the cost of their insurance. 11 million seniors have saved over $23 billion from closing the Medicare Part D prescription drug plan so-called donut hole. Donut hole is a benign way of saying burn a hole. Costs that were burning a hole in the pockets of a lot of Americans, seniors to be exact. And finally, hospitals in states like Pennsylvania getting a lot of help due to the legislation. In Pennsylvania, our hospitals have saved some $680 million due to reductions in uncompensated care. But I think in the end, most of this is about real people and real families and their real lives, and unfortunately, the real consequences that would adversely impact their lives. Among the 3 million Pennsylvanians with pre-existing conditions are 2 remarkable young women whose mother first contacted me in 2009. Stacy Ritter from Manheim, Pennsylvania. Stacy's the mother of 4 children, including twin girls, Hannah and Madeline. That's a picture of Hannah and Madeline a number of years ago. And at that time, they were just 4 years old. Hannah and Madeline were, diagnosed, I should say, at the age of 4 with a rare and dangerous type of leukemia at such a young age. Stacy and her husband went bankrupt, literally went bankrupt, trying to pay for their daughter's medical bills. So she wrote to me at the time saying that without health care reform, quote, my girls, these 2 little girls, my girls will be unable to afford care. That is, if they're eligible for care that is critically necessary to maintain this chronic condition. Punished and rejected because they had the misfortune of developing cancer as a child, unquote. So said Stacy Ritter, one mother in one community in Pennsylvania, way back in 2009, talking about her daughters being punished and rejected as if they had any control over the cancer that they are diagnosed with. Fortunately, Hannah and Madeline are healthy young women today. Now they're freshmen at Arcadia University and are doing well. The Affordable Care Act protects them by assuring that they will have access to affordable coverage, whether on their parents' plan or on a plan in the individual market. But because of their medical histories, they have ongoing health care needs, and they don't know what they would do without the Affordable Care Act. There's a picture of them today. And you can see what a difference health care makes in the life of a child, in this case, the life of two children who are now young women and in college. I don't even want to think about, and we should think about what would have happened without this legislation. We should not ever put children and their families in that circumstance. So if you're talking about a new plan here, you better have a plan that would cover children like Hannah and Madeline, and you better be able to pay for it. You can't just talk about it. You can't just promise it. You have to be able to pay for it, as we did in this legislation. So while we're on the question of costs, let's talk about it in human terms. Human terms meaning young women like Hannah and Madeline. Now, we've heard an awful lot from Republican members of the Senate and Republican members of the House of Representatives. They've been promising to come up with a, quote, better plan, unquote, than the Affordable Care Act since 2010. So 2010, when this passed, March of 2010, you would think by now they'd have a plan that would replace what they had repealed. That's part one. And part two is a plan that is better, because that's what they promised. And they used other words to describe it as well. But now, almost 7 years later, and it will be 7 years in March, where's their plan? I don't think anyone has been able to find their plan. Now, some members of the Senate on the Republican side of the aisle have said recently they have a plan, but they haven't released it yet. Or they have parts of a plan or different plans, but they're putting them together and we'll see them soon. And others kind of don't seem to know whether there is a plan or not. So they promised to replace the Affordable Care Act only after they repealed it, and only after millions of Americans would lose their insurance. But where is the plan after 7 years? You would think if you were serious about a matter of public policy, something as substantial and as consequential in the lives of families, you would think after 6 plus, almost 7 years, you would have a plan ready to go. And that plan would be comprehensive. And that plan would cover at least 20 million people, maybe more. That plan would have all the protections that I spoke of earlier. The young women like that, when they were children, would not have their treatment capped. Someone with a pre-existing condition would be protected. Women would not be discriminated against. So all of those protections, including the coverage, would be part of that plan, you would think. But it seems as if to find the Republican plan here in Washington, you'd need to hire a really good private investigator to look at every corner of Washington. Maybe it's in some of the desks here. Maybe we just haven't found it yet. But so far, there is no plan. No plan. There's a lot of talk and a lot of hot air about repeal, but no plan. What does the Brookings Institute say? They say that the number of uninsured Americans would double if the act is repealed. To be precise, that would leave 29.8 million people without insurance. It would go from 28.9 to 58.7 million people. So I started tonight talking about 50 million uninsured in 2009. If you repeal this legislation and you don't replace it with something that's very close to comparable, that means you no longer have 50 million uninsured like we did in '09. You have 58.7. Let's round it off to 59 million Americans without insurance, despite all the gains that we've made in the last number of years. What does that mean for, what does it mean for Pennsylvania? Well, since the bill was passed, 956,000 Pennsylvanians stand to lose their coverage, because that's how many have gained it. The Congressional Budget Office, which is the Congress's referee or scorecard, the Congressional Budget Office estimates that insurance premiums would rise by 20% if the act is repealed without a replacement. The Commonwealth Fund, in a recent report, estimated that repealing the act would cost our economy 2.5 million jobs per year, not over 5 years or 10 years, 2.5 million jobs per year. Pennsylvania is a state that, despite having huge rural areas, or huge urban areas in both Philadelphia and Pittsburgh and a lot of cities in between, we have millions of people, literally, that live in so-called rural communities, rural counties. By one estimate, of our 67 counties, 48 of them could be categorized as rural counties. So we have a lot of people that live in and make their living, work very hard in rural communities. One of the headlines that caught my attention last week was from the Fiscal Times. This is from January the 5th. You can't see it from a distance, but the headline reads, "Obamacare repeal could push rural hospitals to the brink." All focusing on rural hospitals and the cost of repeal. We know that a couple of years ago, there was a report by First Focus that focused specifically on rural children and their health care. Here's what the conclusion of that report was: that as of 2012, the year they examined, Medicaid and the Children's Health Insurance Program covered 47% of rural children compared with 38% of urban children. So almost half of rural children, as of this report, receive their health care from Medicaid or the Children's Health Insurance Program. Both would be adversely impacted by both the repeal of the Affordable Care Act and the implementation of the House Republican budget, which I think is the most extreme budget ever proposed in Washington. So that's the reality just for rural children and their health care, and also the predictions about what will happen to rural hospitals. A lot of people employed in Pennsylvania, tens of thousands, employed in rural hospitals in our state. One of the individuals who contacted us to talk about this issue in the context of being in a somewhat rural community, but someone who's actually doing farming. And of course, farming doesn't just occur in rural areas. But Julia Inslee, Julia is from Coatesville, Pennsylvania. That's in southeastern Pennsylvania, where we have a lot of farms there as well, just like we do in the middle of the state, in the western and northeastern and northwestern part of the state. But Julia turned her family's hobby farm into a full-time operation. And here's what she wrote to our office in November. Quote, "I am one of millions of people who have benefited greatly from affordable access to health care. I work part-time as a tutor at a community college and nearly full-time as a farmer. Neither one of these jobs provides me with health care, nor do I make enough to pay several $100s in premiums per month. The government subsidy is what makes it possible for me to have health care. If the Affordable Care Act is taken away, I will most likely have to give up farming, and if anything, we need more farmers, not fewer." That's what she says. If the Affordable Care Act, known as Obamacare, is taken away, I will most likely have to give up farming. So why would we do that? Why would we say to someone who has achieved success in any profession or any job or any career, but especially something as fundamental to the economy of Pennsylvania? By one estimate, our largest industry is agriculture in Pennsylvania. Why would we say to that farmer, well, they had this idea to get rid of legislation in Washington, you're just going to have to come up with a new profession. Why would we force people to give up farming in order to meet the demands of some people in Washington? So Julie is facing the likelihood, if the act is repealed, of losing her ability to support herself because her insurance would be too expensive. I have to ask, is this a, quote, better plan? Is this what Republicans have come up with? We shall see. Rebecca Seidel is a dairy farmer as well. She's from Douglasville, Pennsylvania. And Rebecca co-owns a herd of dairy cows and talked with me just last week about how dangerous farming can be and how scary it is not to have insurance. She says, and I quote, "As the daughter, granddaughter, and great-granddaughter of Pennsylvania dairy farmers, I see my share of agricultural catastrophes. Between equipment and large animals, every day comes with potential hazards. Will I break a rib getting between two cows who are fighting? Will a blade come loose from the bedding chopper and hit me? Will my hand be broken through miscommunication with someone operating the skid loader?" These are realities with which I have to live every day, and I am able to go about my job bravely because I know none of these events would financially destroy my family, unquote. She said the Affordable Care Act allowed her to work, and she wrote, and I'll conclude with this, "Threats to the ACA are threats to our future, Senator, and to the future of small businesses, agriculture, and families." So she and her husband, Rebecca and her husband, don't know what to expect with repeal of the law. They want to start their own business, allowing their current employer to hire more people, but they don't know what they'll be able to afford in such an environment of uncertainty. So Rebecca and her husband don't know if they'll be able to realize their plans and start a new business. How is this a better result for them, we would have to ask. And finally, and I'll conclude with this, the story of a businessman, Anthony Valenzuela. Anthony is a small business owner who has been successful with the hard work of one employee who purchases an affordable and comprehensive plan through Pennsylvania's health insurance marketplace. This is what Anthony said as a small business person. Quote, "It's my opinion that the Affordable Care Act is the best thing the federal government has ever done for real small businesses like mine. This bill paved the way for entrepreneurs to strike out on their own, knowing that they have a way to get health insurance. The bill allowed these entrepreneurs to attract professional employees who would otherwise have never left a corporate job to join a small startup," unquote. His business relies on his employee. In this case, he has one that is central to his business. This one employee being able to purchase affordable health insurance, since with only one employee, he cannot get her on employer-sponsored coverage. He said, quote, "Looking forward, we plan to do even bigger and better things, but she still needs health insurance to do it. And if we lose the marketplace, IQ Product Design will likely lose its key employee and will be unable to create the next big market-changing product," unquote. So he's asking what's going to happen. Is there a replacement plan? What happens to his employee? What happens to his business? So we have a long way to go to debate these issues. But I have to ask again, if there is such a better idea here, after almost 7 years now, where is this replacement plan? We haven't heard one word about the details of it. Where is it? I think that's what a lot of Americans are asking. We know what Republicans want to do to repeal the Affordable Care Act, or I should say the Patient Protection and Affordable Care Act, for all those people with insurance who got much better protections solely because of this legislation. So, Mr. President, I would yield the floor.